Welcome to HealthCast, a production from Lexington Health that focuses on the latest procedures, treatments, and the people behind the exceptional care we provide to patients. Today, we're exploring treatment options offered by the orthopedic specialists of Lexington Health to help patients who suffer from knee pain. While knee replacement surgery is the definitive treatment for severe osteoporosis of the knee, Dr. Randy Beard of Lexington Orthopedics and Sports Medicine always begins with non-surgical options. The initial attempts to regain pain-free use of the knee are conservative measures like weight loss, activity modification, knee braces, and over-the-counter anti-inflammatories. If those are not successful, then Dr. Beard tries non-operative interventions in his office.
So most of the time we start with a cortisone injection. This is sort of the gold standard initial treatment. This is the actual medicine here, and this goes into the knee or the other joint that we're treating to help reduce inflammation. Secondly, we would try a gel injection or viscosupplementation. And this is a product to help lubricate and increase the hyaluronic acid inside the joint. And then the third option would be our PRP products, where we take a sample of the blood from the patient, we spin that down in the centrifuge, and then we suck out the healthy healing cells, the platelet-rich plasma, PRP, and then we inject that just into the joint or the target tissue to help with healing.
When those attempts fail and surgery is needed in order to give the patient lasting relief, Dr. Beard uses the DePuy VELYS robot, which is one of the newest technology systems available to surgeons. Inside this Lexington Medical Center operating room, Dr. Beard uses a mock knee to demonstrate the implants used in this type of knee replacement.
As you get ready to start this, the name of the procedure is?
This is a total knee arthroplasty or total knee replacement.
And who is this best for? Which kind of patient?
This is best for the last step in treating arthritis. So end-stage arthritis, failed conservative treatment, and ready to kind of move on to the final step, the real solution, which is total knee replacement.
Before ever cutting on the patient with the saw, Dr. Beard communicates with the robot by entering in the multiple data points of the patient's anatomy. This includes the location of the knee on the table and the stretchiness of the ligaments, the MCL or medial collateral ligament, and the LCL or lateral collateral ligament. These connect the femur and tibia. This collaboration between doctor and machine allows for adjustments to the final game plan before cutting begins.
This is one of the key things that robotics allows us to do, is dial in what we want to do before we do it.
Then it is time to start cutting into the knee, removing all of the diseased bone and cartilage.
But what the robot is doing is precisely holding this saw in space. So it knows exactly where this blade is, and it's making tiny, tiny adjustments every second. So if I shift this knee around, something moves during the operation, the robot is moving with it. And so it knows exactly where everything is. So I can make this cut. And it did it, holding the saw in a precise plane while I do the operation.
The robot has eyeballs, if you will, that use infrared to watch what the surgeon is doing, even deciphering what the human eye cannot.
They can go down to 0.5 millimeter and 0.5 degree, which is just fantastic precision, which has been unmatched prior to robotics.
And no matter how good your eyes are for the surgeon, you would not be able to see it that closely.
Right. We can't really detect those changes, but the robot can.
Even if the surgeon feels certain in his or her ability to control the saw, the use of this technology adds to the doctor's confidence.
It does, because instead of worrying about trying to sort of hold everything perfectly, the robot's taking that away. It's just applying the plan that we came up with and allowing me to execute that plan precisely.
And the doctor can focus on protecting the other soft tissues around the knee. Once the bone structures are cut away, Dr. Beard puts in trial implants. This way he can confirm clinically that the knee has normal range of motion and function.
So we're gonna just sort of take this through a little range of motion We can see how nice and smooth
It is, right.
it is as it moves back and forth. It's well balanced. I'm moving it back and forth. The ligaments are the appropriate tension.
Happy with the results, Dr. Beard then would remove the plastic trial implants and put in the real implants, which are metal. The surgeon then can close up the knee.
So Angela just had surgery yesterday, and as you
Yes.
mentioned, they literally are up the day of.
Yes, and she'll be going
Walking.
home here in just this morning. And so one of the things we need to do is make sure she can get home safely. And most of the time that's in a personal vehicle. So she's not gonna be the driver here, of course, not yet. That'll come in the next few weeks. We're training her how to get into and out of a car safely so she can get home and then get to physical therapy as well, or if she needs to go to a doctor's appointment and things like that.
Dr. Beard says it's a spectrum of recovery.
I sort of divided into the first 2 weeks where you're dealing with maybe some swelling, we're dealing with pain management strategies, starting that early physical therapy. You have a bandage on. You just feel like you had surgery, honestly. Then it's sort of the next 6 weeks after that, you're sort of starting to turn a corner. Pain control is getting better. You're weaning off a lot of medicines. Your bandage has been removed. You're starting to get back to some daily activities. And then really, I think most people would consider the recovery to be about 2 to 3 months following a total knee replacement.
The intense physical therapy teaches the patient how to build up the muscles, especially the quadricep muscles around the new joint, and regain momentum.
At the end of the road, when surgery is the right answer, having your surgery at Lexington is a great option. So the reason I chose to work here is because I knew that I could take excellent care of patients at this facility. And so as a patient, you're asking those same questions. Can I get safe and effective care at a hospital system? And so the answer is absolutely yes. And so when we talk about robotics and doing a total knee, we have a award-winning total joint program that the patients are going to be part of. It's a journey to go through this, and robotics allows us as surgeons to have confidence in the precision and application and execution of a plan that we looked at every time, so that the patients can have a predictable positive outcome.
Because the robot is relatively small compared to other robots, it is easily moved from room to room to help multiple patients in a day here at Lexington Medical Center. It's no wonder U.S. News & World Report named Lexington Medical Center as the best hospital in the Columbia metro area for the 4th consecutive year. To learn more about the advanced treatments performed at Lexington Orthopedics and Sports Medicine, please visit lexmed.com/ortho. And be sure to click the like button and subscribe to our channel to get notified of future stories in the HealthCast series.